living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Whether it's a fall, a wound, some other kind of accident, or even surgery, unfortunately, healing from an injury is part of life. Usually it just takes time for us to heal, but actually diet, exercise, sleep, and even age can play a role in the healing process. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown, and today we're going to talk about healing from an injury. Stay with us. Welcome back to Healthy Living for Life. Joining us first today is Lindsay Grauman, who is a registered dietitian and the owner of Northern Nutrition Group. And thanks so much for being with us, Lindsay.
Yeah, thanks for having me.
Okay, so let's talk about nutrition and the role that it plays when it comes to just our everyday wellness. Many of us may not be aware that good nutrition also helps us heal when we're trying to go through recovery from an injury. So can you talk to us a little bit about what the role good nutrition plays when it comes to injury recovery?
Yeah, absolutely. So with any type of injury, the body is going to experience metabolic stress, and the degree to which depends on the severity of the injury. So metabolic stress is the hypermetabolic catabolic response in the body. So what does that mean? Hypermetabolic means you need more energy or calories because your metabolism has kicked into high gear from the stress of the injury. And catabolic means the body's aptitude to start breaking down components in the body, such as proteins, in order to get the nutrients that it needs. So as the body is trying to heal, you really want to make sure that you're eating adequately to account for the body needing a higher calorie amount due to the stress that it's under, so that it doesn't start breaking down important molecules and components at the same time when your body is trying to heal or build up those molecules and components.
Okay, so we need to be eating healthy foods, but what happens if we just skip foods or aren't eating enough? Does that play a role?
Yes, absolutely. So in the presence or the absence of injury, skipping meals and not eating consistently is never recommended. So in order for our body processes, including healing, to work properly, adequate calorie intake from food is vital. So like I already mentioned, your body needs more calories in order to heal because of that metabolic stress, not less. So skipping meals doesn't lend itself well to that. So for example, making sure you're getting enough protein is imperative because if you're not, your muscles will start to break down to feed your body the protein that it needs, which can delay healing and make recovery harder. Making sure you're getting enough carbs is important because your body is working again in overdrive. So carbohydrates are the body's main energy source. Fat becomes very important too, as fats help regulate our immune system, and because we need fats to absorb different vitamins like A, E, D, and K. So there's a whole host of other micronutrients that we'll get into later that are essential to healing that if skipping meals, your body won't get, which could lead to poor outcomes.
Okay, that makes sense. And you mentioned carbs. Let's talk about some of those nutrients if we can start with carbs. And then kind of the difference between some of those complex carbs and then the more simple carbs. What should we be paying attention to there?
Sure. Yeah. So this concept of complex versus simple carbohydrates has been a bit demonized in society through the weight loss and diet industries. And I really find that most people don't really know the true difference between the two. But first and foremost, at the highest level, when recovering from an injury, that adequate calorie intake is going to be more beneficial than worrying about the type of carbohydrate you're consuming. When we're talking about complex versus simple carbohydrate, sure, maybe that list of nutrients in a complex carb might be longer, but just because it's longer doesn't necessarily mean that it's better. That use of the term better when it comes to nutrition is really something that society really wants to use, and we just can't. We really have to look at the diet as a whole and each person's unique situation. So for example, maybe someone is healing from an injury and they're on painkillers, which causes oftentimes constipation. In this case, I would not recommend the added fiber that comes along with complex carbs. So in this case, complex carbs would potentially be contraindicated and simple carbs would be the better option. So really the simple answer is there's no better when it comes to complex versus simple. They both have their place in our diets and in healing.
Okay. And you mentioned protein too, and that we need a lot. How much?
Yeah. So specific protein needs, again, are going to vary from person to person, along with the type of injury. So someone healing from something like a major burn, a pressure wound, technically are going to need more protein than someone who's just, say, recovering from a broken ankle. So the bottom line is that people need to understand that you need adequate protein, not excessive, which there is such thing as. So like I mentioned, if calorie intake declines, the body will start using protein for energy rather than growth and repair. The industry standard for a healthy adult in the absence of an injury is 0.8 grams per kilogram body weight. But when an injury is present, that can increase anywhere from 1 to 1.2 grams per kilogram body weight. And these intricacies are where it's best to talk to a dietitian to understand what your body needs for your specific situation, injury, recovery.
Okay. I think we have time for one more question. Let's talk about fruits and vegetables. Obviously, those are typically good for us. What role do they play when it comes to recovery?
Yeah. So there's a whole host of vitamins and minerals that promotes healing, like zinc and iron and vitamin A, vitamin C, vitamin D, the list goes on. And fruits and veggies are powerhouses for these vitamins and minerals and have powerful antioxidant qualities, which can help fight inflammation, which is inevitably going to be present in an injury.
Sure.
They provide vitamins and minerals to help promote skin regeneration and integrity, tissue and bone repair, oxygen transport. They can keep you hydrated. They can keep you from muscle cramping if movement's limited. So a good rule of thumb is to eat the rainbow, eat all different colors of fruits and veggies because different colors correlate to different nutrients. So if you're eating all different colors and fruits and veggies at every meal, then that's a good rule of thumb.
Okay, great. That's good advice. And that's the time we have. We're up against a break, but eat the rainbow. We'll remember that.
Yeah. Yes.
Thank you.
Yeah.
Thanks,
Thank
Lindsay.
you.
All right, Coming up next, we talked about nutrition. Let's talk about exercise and sleep and the role that those can play when it comes to recovery. We'll talk about that right after this. Stay with us. Welcome back. Joining us now is Dr. Megan Reed, a physical therapist and clinic manager for Level 11 Physical Therapy. And thanks so much for joining us today, Dr. Reed.
Thanks for having me.
So let's talk about sleep. And what are some of the ways that sleep can help us heal from an injury or a surgery or something? How is sleep beneficial to that?
Rest is actually extremely restorative to our bodies, especially when healing from an injury. The type of healing that needs to occur, sleep can actually be some of the most productive time for that healing to occur. Research shows that neuroplastic changes, so the changes in our brain and our body and the way it connects to our muscles, actually occurs best during sleep. Sleep also helps to reduce our stress levels, which reduces a hormone in our body known as cortisol. And the less cortisol we have, the more conducive our body is to healing. Conversely, sleep allows for growth hormone to actually increase in our body. And that's a hormone that plays a major role in healing tissue and rebuilding muscle.
Okay, that makes a lot of sense. So what are some of the things that interrupt our sleep? Or maybe we keep waking up in the night or we have trouble getting to sleep. Can you talk about that a little bit?
Yeah, so you kind of mentioned it in the question, but really when we're talking about sleep and disturbed sleep, it should be broken into two main categories. trouble falling asleep, and then trouble staying asleep. Common reasons we have trouble falling asleep include late night snacking, use of technology or TV, our cell phones, really close to the time we go to bed. In addition to that, exposure to blue light that happens with the use of those technological devices, stress or anxiety levels, and alcohol and caffeine consumption. Those can all contribute to difficulty falling asleep. Trouble staying asleep can happen for some of the same reasons, but things like a poor sleep environment. So, I'm a mom of 3 small children, and sometimes my sleep environment is not conducive to sleep because I have children that need me in the middle of the night. Frequent urination in the middle of the night, and that can play into the caffeine consumption we had during the day too. But as we age, difficulty with our prostate can cause us to have to wake in the middle of the night. That can interrupt our sleep. Anxiety and depression can actually alter our sleep cycles, so we have trouble getting into and staying into REM sleep cycles. And we have some medications that can actually disturb our sleep. Things like steroids and other medications can actually alter our sleep patterns. So those are common reasons that we have trouble falling asleep. What we can do about it, the good news is there's actually a lot of things we can do. There's a term called sleep hygiene that I work on with patients as a physical therapist. So it's about creating a bedtime routine that helps signal to our body that it's ready and it's time to go to sleep. And that sleep should be coming soon. And that will cause the release of certain hormones that get our body ready to sleep. Setting things like a sleep timer on your phone can seem silly, a bedtime reminder, but it can actually help us remember, like, oh, I need to put my work down, I need to put my phone down and get myself ready for bed. Screen for medical conditions that can alter sleep, right? So if you're thinking you might suffer from anxiety or depression, which many of us do, reaching out for help in that regard. Things like sleep apnea are something a lot of people deal with as well. And that can, treatment for that can help us sleep longer and in better stretches. Again, I mentioned the prostate, so screening for an enlarged prostate, things like that. And then if anxiety or depression or shutting your brain off is something that's challenging, I recommend to clients creating a brain dump list, just kind of like a to-do list. You can keep a notepad next to your bed prior to going to sleep, and that can help your body just kind of get ready for sleep, let go of your responsibilities for the day, and prepare more for sleep.
Okay, perfect. Let's switch gears, Megan, and talk about pain. So obviously, if we're recovering from an injury or a surgery or something, pain is going to be part of that. But my understanding is pain can hinder the healing process. So can you talk about that a little bit, and what can we do about it?
Yeah, so pain is actually an output from our brain, and its intention is to keep us safe from harmful things in the environment. So pain is a very useful stimuli. But when recovering from an injury, this output can actually become overactive, and that's when it's counterproductive to our healing, right? So if we're healing and we're in danger and bending our knee too much causes pain, we should listen to that. But at a certain point, we need to work on the pain response and tolerate more bending to recover from a knee injury. So we have to interrupt the pain signals and kind of retrain the sensory nerve endings in our body to respond to things like movement more productively.
Okay, and I think that speaks to sort of developing that new normal or getting used to how your normal might be now. So can you talk about that and how that relates to life after an injury?
Yeah, it can certainly be overwhelming when considering a new normal after an injury, especially a catastrophic one. I think an important thing for people to keep in mind following an injury is that everyone's recovery looks different, and comparison can be a valuable tool, but it can also be overwhelming and really self-limiting. So taking your recovery one day at a time, showing up the best you can to each therapy session, having a strong support system and a rehab team that you trust in and feel confident in the plan can actually make all of the difference in a world when it comes to recovering and establishing what your new normal might look like.
Okay, we have less than 30 seconds, but I want to sneak in a question about exercise and how we need
Sure.
rest when we heal, but we also need exercise, right? So speak to that a little bit. How is that an important part of our healing process?
I could speak to that all day long. Exercise is a key component to all recovery. And the key is that the exercise is designed methodically and with skill, right? So we want the right type of exercise. I often tell my patients, no pain, no gain is not a phrase that we're using in the terms of recovery. Our body needs exercise in order to create new connections and to strengthen our tissues that are healing. Certain stresses can be applied to those healing tissues that will actually cause them to heal in a stronger, more functional form than they were prior to the injury.
Okay, all right, great. We are up against a break, so we do need to pause here. But when we come back, we're going to talk about how your mental state can help the healing process and also thinking about risk factors that might slow down healing. So stay with us. We'll be right back after these messages. Welcome back to Healthy Living for Life. We're still talking with physical therapist Dr. Megan Reed. Thanks for sticking around with us. And you know, you talked about stress and its effect on sleep. Let's talk about stress, anxiety, and its effect on the healing process. How do we know that can hurt our effort in healing?
Yeah, absolutely. So stress and anxiety and depression can definitely alter our healing process. They can cause the release of a hormone that I mentioned earlier, cortisol, that's actually very counterproductive to healing. It can slow down our response to healing. It can alter our inflammation process, which is actually very valuable in healing. Navigating stress, anxiety, and depression can also make it difficult to feel motivated to adhere to your rehab program and do the exercises that you need to do as part of your recovery. It can just kind of suck the motivation right out of you. So stress and anxiety can definitely play a role in our healing.
Okay, so obviously we want to try to manage those things anytime, but how can we pay special attention to those sort of mental conditions or mental states while we're in recovery?
Yeah, we want to practice things like mindfulness, right? We want to check in with our body and see how we're really feeling. I think our natural inclination is to kind of push those feelings aside if we know that maybe they're not advantageous to our healing. But I encourage people to really appreciate what we're feeling, know that our feelings are valid, because recovering from something like an injury can be stressful and anxiety provoking. We can feel a little bit depressed. That's normal. And rather than trying to ignore those feelings, let's try to deal with them. Let's talk about how we're feeling. Our body can really harbor stress, like I said, release that cortisol and be counterproductive to our healing. So dealing with our feelings is actually way more important than kind of pushing them aside and trudging through.
Yeah, that makes a lot of sense. That's good advice. Are there other emotions or mental states that we need to be aware of or think about that might hurt our recovery?
Just the anxiety, depression, anger, like any negative feelings can have a negative impact on our recovery. And it doesn't mean you can't feel those feelings, but being mindful when you are feeling that way and reaching out to either your support system, or if you're lacking the support system, to a physician to let them know that you're struggling with that is really important. I think conversely, feelings like love and laughter and happiness can actually be very helpful to our healing, and that's important to keep in mind too.
Okay, have that positive attitude. So let's talk about some of the other factors that might impact our healing, and my understanding is age is one of those. What's going on there?
Yeah, so as we age, a normal aging process actually means that our cells turn over and regenerate at a slower rate, which means everything happens slower, including our healing. The inflammatory response in our body, which everyone thinks inflammation bad, but actually inflammation is very key in healing. Our inflammatory response is decreased as we age, and it slows down. So those things alone can really impact our healing as we age. And then as we age and live a longer life, our possibility for developing things like hypertension and diabetes also increases, and those things can impact our healing.
And then also older men tend to heal slower than older women. Do we know why that is?
So if we're looking just at gender, so many things go into healing, but the role of sex hormones can definitely impact our healing. So testosterone and estrogen can play different roles in healing, but I really want people to keep in mind that there are so many factors that they can control in their healing, and gender is just one of them.
And then what about the use of steroids or even alcohol consumption? What does that do as far as our healing process goes?
Exactly. Steroids can actually, so steroids do a lot of things. Steroids decrease our inflammation response, right? And I just mentioned that it's very important for our bodies to go through an inflammatory response to heal. There are absolutely times where steroids are indicated for that, but long-term use of steroids and inappropriate use of steroids will actually hinder healing because it takes away that inflammatory response. It can also do things like make our bones a little bit weaker, and our tissues a little bit weaker, more prone to injury. Alcohol use actually impairs our circulation, again, which ultimately comes down to the inflammatory response and our body's ability to bring the healing agents to the area we're trying to recover.
Okay, and are there other medications we should know about or substances that might get in the way?
I think anytime we're talking about medications, the best thing to do is to bring your physician on board. You always want to have someone who is looking at the big picture of things, certainly. So my recommendation is always to go to your doctor to talk about the medications.
Okay, perfect. We're almost out of time. Is there anything you want to make sure we hear or take away from this conversation today?
Yeah, I just think no matter the injury, a really important thing to consider is the whole person and the holistic approach. So if you're recovering from a knee injury, I keep bringing up the knee today for whatever reason, but if you're recovering from a knee injury or a back injury, we're not just looking at the healing of your back, right? Your whole self matters. And so taking care of your entire person, from diet, nutrition, to sleep, to your emotional health, those all play a role in your healing.
Perfect. That's a lot of great information, Dr. Reed. Thank you so much.
Thank you.
And I want to thank Lindsey Grauman also for all the great information she gave us earlier in today's program. And thank you so much for joining us. We hope you'll come back and see us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.